Hi, Kara. So tell us a little bit about the Permea.
Perfect. So the Clear and Brilliant treatment comes in two different types. Today we're using the Permea tip on our beautiful patient here. This one's great for targeting some of the dark pigment areas that patients have, especially this time of year after sun exposure, living in sunny Southern California. And it also helps a little bit with the pore size, the texture of our skin overall. So we're going to go ahead and kind of get started. This treatment's very comfortable for patients, and usually there's a little bit of redness the day after and right after. I actually did my own treatment last night with it, and I'm here at work today, and
your skin looks
pretty
fantastic.
Good. Feel a little dry, a little tight, but that's to be expected, and I'm looking forward to my results in about a week.
Wonderful. Okay, so this is something that a treatment somebody could do without having a lot of downtime. They could just kind of go right back to their daily activities.
Exactly.
Okay.
I usually tell patients the day afterwards you might feel a little bit puffy, almost like you've been to the beach and you have like a sunburn to your skin. Typically, you can go to work that day, put kind of cover up makeup. I prefer to use Color Science line that has the SPF 50 in it. It helps to block out a little bit of that dark pigment as well. And then patients can go about their business. I tell them, you can exercise, you can do pretty much any of your activities that you would normally do, still just avoiding sun exposure, and your skin's going to naturally kind of turn over those cells, and you get your nice results in about a week.
Wonderful. Is this your first Clear and Brilliant Permea treatment?
Mm-hmm.
And what are you looking to accomplish?
I would love my pores to be a little bit smaller. So overall texture and skin tone. I've got melasma, and this is the only procedure that's safe to do on melasma-prone skin.
Wonderful.
That's true. This laser is actually safe up to a skin type 6 as well, which makes it one of my favorite treatment options because it's safe, it's effective, and it's just a great treatment, no downtime.
That's wonderful. Would you combine this with other treatments or other products besides the skincare that you mentioned afterwards?
Great question. So a lot of times when I'm talking with my patients and doing a consult, we kind of go over what they're normally, their skin routine, what they're using regularly. Natasha's a great patient because she's working with us here at the office. So she already has a really good skin regimen, and she's currently using our hydroquinone pads, which have a 6%, and that will help to lighten and brighten her skin as well as using some Retin-A's. You want to stop that a few days before the treatment just so that there isn't any, more redness and flaking afterwards. But yeah, it's definitely something that you can combine in with your routine to kind of give you like your nice glowing skin.
Great. Let's get started, and I'll get a little close up here so people can
Perfect.
see what this treatment is like.
All right, Natasha, so we're just going to start right here on your forehead. Another great treatment that you can add in combination with this is the Hydrofacial. The Hydrofacial is a great treatment option for patients to kind of just help to add some more peptides into their skin, as well as kind of infuse their skin with some nice antioxidants, and it also helps to kind of take out any of the debris and dirt that we have naturally found kind of in our skin.
Should patients wait in between treatments?
Great question. So usually I have patients kind of, wait about 2 weeks, and I have them come back and do another series. So usually we sell these in a series of treatments. So usually I have patients come in and they'll do like a Clear and Brilliant, and then they'll do another Clear and Brilliant 4 weeks later. So if they're combining it with the Hydrofacial, I like them to do it about 2 weeks after the Clear and Brilliant. That way their skin's kind of turned over there, and they're just kind of helping to add some nice products to the skin to kind of help everything give it a nice set glow. I'm going to turn you just a little bit here. So you can see that Natasha's very comfortable here getting the treatment. How would you say you would feel a 0 to 10 on the pain scale?
Like a 1, some spots a 2. It's not bad at all.
Good. And she'll get a little bit pink as we kind of work over the areas. This redness that she's going to be experiencing will kind of peak right after the treatment and then kind of subside over the next 24 hours.
And you can customize the level that you want this treatment to be at?
Of course, yes.
Okay.
Excellent question. So on Natasha, this is her first treatment here with us, so she's doing really well. Usually most patients find that this is a very comfortable laser and treatment option for them, so they can tolerate a high level. There has been, cases where patients might feel a little discomfort, and we can turn it down for them. But for the most part, usually I try to keep it a little bit higher for patients.
So this seems like a wonderful treatment pretty much for anybody, and certainly something they can do in between their other maintenance treatments, or maybe during the summer months when the sun is intense and they want to be a little cautious with sunscreen.
Exactly, yeah. I actually did this treatment a few series before heading to Hawaii this year, and for the first time ever, I was able to wear no makeup when I was at the beach, which made me feel really nice and comfortable, and my skin glowed. And I have melasma, and this has really made my melasma have a huge improvement overall.
Wonderful. And how's the treatment feeling for you?
It's very comfortable.
That's great. Well, I look forward to seeing your results, and we'll check back in with you when she has a chance to follow up. Thanks, everybody. Thanks, Kara.
Thank you.